This is a tragedy that is unfolding, and people need to understand that people that become very sick from this are not surviving, and we do not have any miracle cures or magic bullets that's going to help at this point. And today was just a really difficult experience to see such illness and such death constantly.
People were dying, and we were having to notify family a couple times, per shift, which is not something that typically it doesn't happen with that frequency in any normal environment.
The good thing is that the team is strong and sticking together and keeping our spirits up, but this is going to wear heavily on everybody. And if people don't think that the social distancing and the efforts to flatten the curve matter, they just need to spend an hour in the ER and see how truly tragic it is. So
it's one thing to be face to face with somebody and tell them that their loved one has died, and that's always a difficult thing. But to have to do that over phone, that's a different beast, and it's a little too impersonal, and it's a little too it's not right.
Heading in for my night shift. Not much rest this evening. Still thinking about last night. This is hard.
We're seeing a lot of people with, at least in my hospital, a lot of people with diabetes complications related to it. I had one patient who was probably early 50s, had the classic COVID things, but also was having, diabetic ketoacidosis. And we were trying to sort of skate the razor's edge of both of the disease processes. And, ultimately he did not survive. And it was sort of like really frustrating and really sad.
It's about 5 o'clock in the morning, and finally catching a momentary lapse in the excitement. I want to say something positive. I want to say something that's good. And the only thing I can say is that we're very lucky to have dedicated people that care about others, because this is a disaster. And it's not just the doctors or the nurses, but it's EMS, it's the environmental services people, it's the clerks, it's everybody. It's everyone that makes this work. So I'm just thankful for that.
Last thing that I want people to do is to just be scared, because fear is what makes all of this worse. And we're gonna figure this out. I'm confident in that.
Another day back again, and a little bit better, glimmering of hope, but still too much. Still too much.
A week ago, Sunday was when there were 18 to 20 intubated patients in the emergency department, and today there are 4. And so, the trend seems to be, and I knock wood, whatever, totem that we would use for luck at this point, I hope it continues. But it seems like that massive surge that we were seeing is starting to wane. And so I don't know. I I really hope, because you know, when I saw the numbers this morning, I was overjoyed. I was overjoyed that it's still 4 people that are intubated in the ER, and there are still 80 plus in the ICU, and it's still not good in normal terms, but it's certainly a trend towards the positive that I just hope continues.
And I'm not even working in the busy area, the COVID area today. I just